As my title says, I'm going to talk about vape content on social media, a area that I have a particular interest in. Today I'll be presenting on research that investigated TikTok and Instagram e-cigarette content and how experts from public health, social media, tobacco control and marketing believe e-cigarette content can be better managed on social media. Before I commence, I'd like to acknowledge that I'm speaking on the lands of the Whadjuk Noongar people and acknowledge them as traditional custodians of the land. I'd like to extend that respect to Aboriginal and Torres Strait Islanders who are online today. So to set the scene for my presentation, I'll just give you a little bit of background. So as we can see on this slide, in 2024, revenue in the e-cigarette market in Australia and Oceania was estimated to be about US $360 million. So when we think about how many people are active on social media, about 20 million Australians are, which is about 80% of the population. And young people are prolific users of social media. And the popular platforms are TikTok and Instagram. And so that's why we looked at them. And we know there is an association between social media posts featuring e-cigarettes, low perception of harm, more positive attitudes to e-cigarettes, and increased uptake. And this is for both paid advertising and user-generated content. So that's why it potentially is so harmful, in that the more you see, the more you think it's acceptable as a young person. So traditionally or historically, social media platforms have self-regulated, guided by their own content policies. However, on reviewing these policies, we found this content to be very vague and at times hard to interpret. And we know that policies are not legally binding. It's up to the platform whether they're going to implement them or not. So what we wanted to know is how e-cigarettes are promoted on TikTok and Instagram, two platforms particularly popular, and determine how effective these social media platform policies were in preventing e-cigarette content. So this slide is the result of two studies which took considerable time. So, and it briefly shows what we found. We worked with a lawyer to ensure that our content analysis was appropriate. So what we did is that we looked at, using content analysis, we analysed was it pro-vaping messaging, and it was on both platforms. Very often the brand and the logo of e-cigarettes was visible. There were limited health warnings around these products, and a lot of them promoted the purchase, and there was often no disclosure of sponsorship from, say, influencers or others. And when you look at if they violated on Instagram Meta's policy or TikTok's policy, you can see that it's only about 20%, which is kind of interesting when you see that most of them are pro-vaping. So why is that? So I just wanted to highlight to you something about Meta tobacco policy, as TikTok has a policy as well. But they're, as I said, they're often vague. So if you read this, it says, so the policy states, do not post, upload or share content that attempts to buy, sell or trade tobacco, which includes e-cigarettes, except when the page, group or Instagram profile represents a legitimate bricks and mortar entity, including a retail business, a website or brands, or private individual sharing content for a bricks and mortar entity. So essentially, if you're a legitimate entity, online retailer or bricks and mortar retailer, as long as you don't sell the actual product directly on Instagram, it's fine to promote it. So what you'll often have is a link to a website or information on a bricks and mortar entity where you can purchase, which seems fairly inadequate. So in understanding that, we wanted to know, how do we deal with this issue? We wanted to identify approaches for controlling exposure to e-cigarette content. So we consulted a number of experts from the UK, US, Canada. And the interesting thing is we didn't just go to health experts, we went to social media experts, lawyers, and asked them what could be done about this. So there were two areas that were identified, and this is where I get a bit wordy with these. I've tried to condense them as much as I can, so bear with me. There were two overarching themes. So we identified with these people that it is a complex issue, and you go, yes, well, it is. We all know that. And then we asked them, what are the areas for action? So what I'm going to explain to you now are the themes that were generated from these interviews and the sub-themes. So, as I said, in the interests of time, I've tried to really condense these. So on the left, you'll see the theme, and on the right, you'll see the sub-themes. So in regard to it being an issue, social media being an issue, traversing borders, we all know that crossing borders is a real issue. So it's globalised, it crosses regions, it crosses countries, which makes it really hard to control. And crossing sectors, a number of sectors involved in and affected by social media company activities, including health, media, communication, law. So there are questions regarding who should be responsible for the management of social media companies and their content. And then we go to ungovernable. So the first one is global landscape. So different landscapes have different regulatory frameworks. And the relative newness and pervasiveness of social media means that the development and implementation of regulations is lacking, outdated and slow to change. And then we have vested interests making it more complex. So the tobacco and vaping industry for pro-vaping actors are running counter to any kind of controls. Then self-regulation, current self-regulation hampering the ability to adequately manage e-cigarette content. And then finally, opacity, challenges distinguishing between organic and paid content. So even though when a product or a post is sponsored and they have received some kind of payment, they often don't reveal that. So this is the factors that were identified as making this a really problematic area to work in and control. So then we said to them, well, how do we manage this? And the interesting thing was that the social media people were far more positive around these organisations or these social media platforms being controlled. So once again, the theme is on the left and the sub-theme is on the right. You'll see strengthening institutions. So, and under that is policy and legislation. They stated that there needs to be appropriate legislation far more powerful than the existing self-regulation that existed. Global to local, we need international government leadership. Social media companies cross borders, but tech companies, they have the capacity to adapt to different laws. And as seen with the EU's General Data Protection Regulation, considered one of the strictest privacy and security laws globally. And the UK Online Safety Act, which ensures that media platforms are held responsible for the content they host. So there are examples that they can be better controlled. Then we go to individual and organisation. There's a need for organisations to play a role in the management, and who should play a role in the management. A number of Australian organisations were suggested. It was the Australian Government Department of Ageing, the ACCC, the E-Safety Commission, the TGA. They were the organiser nominated as being really integral to the management of these platforms. Then go to defanging industry, which focused on what social media companies need to do. They need more moderation to identify unwanted content, so more actual people moderators. But a lot of the social media people said, look, they have these organisations or these platforms have the best software engineers in the world. They can manage their content. Responsibility and transparency, social media companies have a responsibility and capacity to systematically remove content that violates their policy. And then complaint system, which is much like the old alcohol system, where recognised opportunities for maintaining and extending the complaint system at an individual and organisational level. And thirdly, the theme, engaging citizens, bringing people along by raising awareness and also tailoring content. So raising awareness, public education regarding the need for better management of social media, so making people aware that something can be done, making people recognise the benefits of managing social media and reducing community exposure, so creating an online safe environment. Framing messaging to the community by highlighting the rights of children and reduction in communicable disease, and building on existing work by taking a combined approach to other hazardous products, such as gambling, smoking. So all these approaches can be used for any product and could be combined. So after we sorted through all this data that we had, we held a sense-making workshop. And with people once again from public health, marketing, advocacy, social media. Through a facilitator, we prioritised actions which are listed here. Priorities that once again could essentially be used for other issues such as gambling and alcohol. So moving on from that, what's happened now is that there's a new act, and the new act prohibits e-cigarette advertising and sponsorship on social media. And it would seem a lot of what we've said in our research and found in our research has been implemented to a certain extent. Well, it's been enacted, but it hasn't been kind of acted. So the new act prohibits e-cigarette advertising and sponsorship on social media. It's envisaged that this new legislation will come into effect on the 1st July 2025. So what we'd like to do is take the data that we have now from Instagram and TikTok prior to the introduction of this act and see, after the act has been introduced, what changes, if any, have occurred. All we need to do is just get some funding and secure some funding to do this, and we are hopeful. So what I presented to you today is an outline of a Healthway funded project that entailed 3 components: content analysis of TikTok, content analysis of Instagram, and then talking to experts about what should be done. And now we've seen something that has been done with the new Public Health Act. So that's pretty much all I wanted to say, but before I end this presentation, I'd really like to acknowledge all these people and our funder, because it takes a lot of people to do this work, as I'm sure everyone's aware. And finally, I'd like to thank everyone for listening, and these are the publications if you would like to have a look at them. And that's all. Thank you.
Thanks so much, Jonine. That was a fantastic presentation. We do usually hold all our questions for the end, but Jonine needs to catch a plane at 1 p.m. So we thought we might open it up for a couple of minutes if anyone had any questions they'd like to pop in the chat.
Have I stopped sharing?
I think you're still sharing.
Oh. I'm an nincompoop.
While we're waiting to see if anyone has any questions, I have a question, Jonine. I'm curious about how they are planning to enforce this new public act.
Yeah, I know. It's yet to be seen. Like, it's all there. If you want to go online to the federal governments where that legislation exists, it's all written out there. What we really want to do is really analyse in the future is, if we can get some funding, is analyse this legislation and really understand it and put it into layman's terms, and then take that and assess what's going on. Because it's great, as everyone knows, it's great to have legislation, but if something isn't monitored, if it's not enforced, then it's of no value. I hope that answered your question.
It does, yeah. No, I think those are great next steps, and I'm curious to see the results.
Yeah, I'm curious to see too.
As well. Okay, I think we'll move on to our next speaker.
Okay, bye. Thank you.
Hi. So our next speaker is Lorena Chapman from Cancer Council WA, and Lorena has been working in tobacco control for over 13 years and is currently the Clear the Air Senior Coordinator at Cancer Council. Thanks, Lorena.
Thanks so much, Kathleen. I'll just quickly share my slides with everyone and see my notes there. So I'll take that one. Apologies, it's just...
That looks good.
Perfect. I'll just quickly escape because now I can't see my notes. Okay. Well, thank you so much for allowing me to attend today's webinar to present to you about our work at Cancer Council WA to address vaping. So like Kathleen said, my name is Lorena Chapman. I'm the Clear the Air Senior Coordinator at Cancer Council WA within the Cancer Prevention and Research Division. Before we get started today with my presentation, I'd also just like to acknowledge the traditional custodians and owners of country on which I'm meeting with you and joining from today, the lands of the Whadjuk people of the Noongar Nation. I would like to acknowledge elders past, present and emerging, and thank local Aboriginal peoples across all our beautiful countries for looking after this beautiful land for over 60,000 years. So the Make Smoking History team at Cancer Council WA delivers 3 programs. So I'm here to talk to you about one of those programs, which is Clear the Air, but I just wanted to also just very quickly share some details about our other programs. So Make Smoking History program has been delivered for 25 years. So we celebrate our 25th anniversary this year. So our focus through Make Smoking History is conducting and delivering public education campaigns, commissioning and conducting strategic research projects, advocacy work and targeted interventions. In 2023, we joined a national community practice and brought Tackling Tobacco to WA. So Tackling Tobacco is a Cancer Council New South Wales program, and we were very excited to bring that program to WA in 2023. So Tackling Tobacco is an organisational change-based program, and we work alongside community services to identify tailored solutions for addressing smoking at their service and integrating the work they're already doing, as well as looking at opportunities to address vaping as well if there is a need. But today my presentation will focus on our Clear the Air program, which we established in 2023. So where did we get started? So like our fellow public health partners, Cancer Council WA has been working tirelessly to address the rising concerns of vaping, especially among young people. For a large amount of time, we've had to do a lot of this work at the expense of our main tobacco-related work. But we were very fortunate in 2023 to receive some dedicated funding from Healthway to create a vaping prevention digital campaign. So the digital campaign aimed to address the rising use of vapes among West Australians aged 14 to 24. And after extensive formative research with young people, the Clear the Air brand was born. Oh, something's glitching on my screen. We used formative research to develop the Rotten Fruits campaign, which launched in October 2023. The campaign aimed to raise awareness about the harms of vaping and specifically focusing on the chemicals found in vapes to share that information with young people to help them make an informed decision and motivate them to quit. So it was focusing on preventing uptake among those susceptible to vaping, so with that prevention lens, but then, as I said, also encouraging young people around who also were already vaping to make a quit attempt. So the initial campaign ran until the end of June 2024 across Instagram, Facebook, Snapchat, TikTok, Twitch, YouTube, streaming services, and mobile apps. And the campaign was supported by a new website, which was designed specifically to reach young people. And you saw that screen rolling on the screen, but something's happened to my screen. I think it's just glitched there. So I also wanted to just share a copy of the poster that my colleague Sarah Beasley developed and presented at the 2024 Oceania Tobacco Control. So you can see here that this is a presentation around that wave of campaign, and we're very excited that Sarah won Best Poster Award at the presentation for her poster. So where do we go from here? We did a lot of research talking to young people in 2024 to find out a bit more about where they were at with their vaping, thoughts around quitting, including motivators and barriers to quit. So our research found that there is a growing discomfort about the potential harms of vaping. So, young people are finding them harder and more expensive to purchase, and that young people don't have a lot of knowledge about the amount of nicotine in vapes and the implication for addiction. So we asked around finding out about what was motivating young people to quit vaping, some of the barriers to quitting. And it was coming through that young people who have already become addicted to vapes were lacking knowledge or support to quit. We found that people, professionals working with young people, didn't know how to engage with them on this topic, and that young people wanted to hear from their peers and hearing from young people who had already made a quit attempt and learning from their experiences. Taking all this on board and knowing that we needed to do more, we were very fortunate in 2024 to receive some additional funding from Healthway, as well as some additional funding from Lottery West to be able to expand the work that we were doing as part of Clear the Air to make it a more comprehensive approach. This additional funding is enabling us not only to expand the work of the campaign and run a second wave of the campaign, but also look at community-based strategies that we can be delivering as well. The opportunity to provide support for professionals and settings and organisations who are working with young people and have that trusted relationship with young people, and may have potentially had young people coming to them already to asking for support to feel confident to know how to address vaping with those young people. We also have the capacity to look at commissioning relevant strategic research, developing resources and working to be able to support young people and professionals working with young people, and also continue our important advocacy work as well. So I just really wanted to quickly run through some of the work that we've been doing already today as part of this comprehensive approach. For our work with young people, we were hearing that they feel that they don't like the control that vaping has had on their lives, for those who are already vaping. That nicotine addiction occurred unexpectedly and unintentionally, and which is then having an impact on their daily activities. And needing that support to be able to break free. And also wanting to hear from experience of other young people as well. So our new campaign focuses on the harms of nicotine addiction, and it aims to equip young people with the knowledge they need to break free from vaping. So I did have some of the ads on the next screen to share with you. So I'll just quickly run through those, just being conscious of time. So I might just share a couple of them with you. But first, I just wanted to give you a bit more information about the campaign. So the campaign's message emphasises that quitting vaping is possible and that many others are doing the same. So our testimonials have come from Cancer Institute New South Wales as part of their Every Vape is a Hit to Your Health campaign, and they are real stories of young people who have quit vaping. We have rebranded the messaging with the "You Can Break Free from Vaping" tagline. So the campaign has also includes new audio ads made by Cancer Council WA, which has been developed using quotes from our research with young people. So I'll just quickly share some of that now. So hopefully you can hear that. If you can't, please let me know.
Not wanting to vape all the time, it feels just a lot better. Not having it as like my number one priority.
You know, it's funny, I didn't expect it, but I started coming back to myself. And then I was feeling so much better because I was actually sleeping a full night.
I could fully run again. Like, I could run 3 times around the block and be slightly winded.
Join the crowd breaking free from vaping. For tips, visit cleartheair.org.au.
I feel way happier, more productive, more social, more relaxed. My mood is better. I was missing heaps being addicted to vaping.
It is exhausting to feel like something's running your life. It's so nice feeling in control again. It makes me feel like I can take on anything.
I'm not going back. They've been the root cause of my anxiety for over 2 years, and I'm done.
Join the crowd breaking free from vaping. For tips, visit cleartheair.org.au.
I was vaping almost every couple of minutes of the day, first thing in the morning, hit my vape, and during classes at school. I think I was having a hit of it every 10 seconds.
It's insidious. You won't realise that you get hooked on it.
And you think you're not going to get addicted, but you will.
Okay, I might just leave it there, but on the next slide.
Not wanting to vape all the time, it's happier.
Sorry, everyone. So our campaign messaging is directing young people to our website. So you can use the QR code on the screen to visit the website and see more about the campaign. The website was updated since Wave 1 to have more of a focus on the signs of nicotine addiction, including understanding what that means and more on how to quit. When young people visit the website, they'll be able to take the Am I Addicted quiz. There's a quit savings calculator so they can find out how much they're actually spending on vapes, and tips to help them quit as well. So I encourage you to check that out, and if you have any young people in your lives, to share this resource with them. In the last little while, I just wanted to very quickly also share about some of the community-based strategies that we're working on. So we've been doing a lot of presentations and engaging with a lot of stakeholders, internally and externally, to be able to not only spread the word in regards to the work that we're doing, but also here in regards to opportunities to work with these stakeholders and be able to increase the capacity to engage with young people. I wanted to specifically give a shout out to the Youth Affairs Council of WA, who we've been working with, and they've been amazing in supporting us in determining the best way to engage with young people. We were very lucky at the beginning of April to be able to bring James McLennan, an experienced psychologist and smoking and vaping cessation expert, to WA to run a series of professional development events with us. So these events were designed to empower people working with young people with the tools they need to have confident conversations with young people who vape, and support them to break free from vaping. Through evidence-based insights, hands-on training and delivering brief advice and tailored support techniques, we hoped that attendees who were able to attend the events gained the confidence and skills to be able to provide this support to young people. So we ended up hosting 10 professional development events and a mixture of in-person and online events for the audiences that you can see on the screen. The online events were recorded and will be shared through our soon-to-be launched Community of Practice platform. And overall, the feedback from the events were very positive. If you weren't able to attend one of these events and want to learn more, I'll share my details at the slides at the end of the presentation, so you can get in touch to find out how you can access the recordings. And I just wanted to quickly share a couple of projects we have coming up soon. So we will soon be launching a campaign competition for a youth designed campaign assets. So these will take any format of posters, TikTok style videos, artwork, etc. There will be prizes, and so we would love to be able to spread the word far and wide. So if you have any contacts or you're working with young people and would like to support us in getting the word out, please get in touch. We also, like I said, are establishing an online community of practice for staff and volunteers working with young people, including those in health, community, youth, education and sports settings. So this will provide a space for connection, collaboration and knowledge sharing to prevent vaping and support young people to break free from vaping. So stay tuned for more information on that soon. So just a couple of links here to our Clear the Air website and also our Make Smoking History website as well for those who are interested. And at the very end, I just wanted to give a plug for our Tackling Tobacco program, who are recruiting for community service organisations now. So if you want to learn more about the Tackling Tobacco program, please scan the QR code or get in touch with the team to discuss that as well. And I have just included our contact details on the slide, so please get in touch if you would like any more information as well on Clear the Air or any of our other programs. But I'll stop sharing my screen now and pass it back to Kathleen.
Thanks, Lorena. Such important work and a very informative presentation. And I'm sure we'll share slides as well following today's webinar so everyone can access all of that. And we'll move straight on to our next speaker. So Jaslyn East from NDRI, who is working on a national trial of the Our Futures vaping program, an evidence-based educational initiative designed to prevent the uptake of vaping in adolescents. Thanks, Jaslyn.
Awesome. Thanks, Kathleen. I would like to begin by acknowledging the land that we meet on today, the Wadjuk people of the Noongar Nation. I'd like to pay my respects to elders past, present and emerging. So I'm Jaslyn. I'm a research assistant at the at NDRI, National Drug Research Institute at the Perth office. And today I will be presenting the cluster RCT of a school-based vaping intervention. I will present the study development, the study protocol and findings. Firstly, I would like to acknowledge our team of 23 investigators across 6 universities and our funding bodies. The trial is being led by the Matilda Centre, of whom NDRI has a long-standing collaboration history with. So as the other presenters have discussed, the rise of adolescent e-cigarette use has become a global public health concern. Being that vaping is a relatively new phenomenon, we are still learning about long-term impacts. However, we do know that e-cigarettes can cause numerous acute and chronic health harms, such as poisoning and serious lung injury. It is evident that effective and scalable prevention approaches are urgently needed. We know that nicotine has impacts on cognitive function, especially learning, memory, and attention. And we also know that it can cause changes to the brain structure, particularly in the regions that are associated with impulse control and reward processing. We can also see alterations to neurotransmitter levels. Chronic exposure can lead to the dysregulation of dopamine levels. We know that adolescent vaping is a concern, but how many young people are actually vaping? The same team behind the current study recently explored this data using a previous study, Health for Life, and this is one of the largest school-based prevention trials in Australia. It included students from 70 schools across New South Wales, WA and Queensland. Through this work, it was found that 26% of adolescents aged 14 to 17 had tried an e-cigarette in their lifetime. 20% had done so in the last 12 months, and 10% had used an e-cigarette in the last 30 days, and almost 6% were regular users, meaning that they had vaped in the last 30 days and were also vaping weekly. I just want to note that the data may not be nationally representative, and that the majority of the young people were living in major cities. Nonetheless, it does align with the recent Australian Secondary Students Alcohol and Drug Survey. So in terms of ways to tackle this, we know that the school is an ideal prevention setting for adolescents. However, common barriers for effective school-based vaping prevention include a lack of evidence-based resources and a lack of room in the curriculum. Further, while there are fantastic health-trained and physical education teachers, sometimes when teachers from other learning areas are required to take health classes, the lack of specific training can also function as a barrier. The Our Futures prevention model is designed by the Matilda Centre to overcome these barriers. This evidence-based education platform has an emphasis on supporting and placing a minimal burden on teachers. The model is designed for all students regardless of their level of risk. It adopts a harm minimization approach and social influence approach. It utilizes interactive online cartoon storyboards that allow us to deliver a peer-led messaging learning style. We have now applied the Our Futures model to the prevention of e-cigarette use and created the Our Futures vaping program. I'll talk now a bit about the development and how the program became to be. The program development was largely carried out by the Matilda Centre, and this consisted of bringing together an advisory expert group, conducting a systematic literature review, consulting with our target group or young people, developing the intervention, and then user testing. The systematic review was conducted to understand what other school-based interventions are currently out there and whether they are effective. The results of the systematic literature review indicated that there is a need for these types of interventions in Australia. The QR code will take you to that publication. The first round, the project consulted with young people in a co-designed project to make sure that the intervention stories and scenarios were realistic and resonated with young people. The aim of the focus group was to understand more about vaping from the perspective of young people. Okay. As you can see here, after the consultation with our focus groups, the characters were made to look younger. There were clothing changes. We have our first non-binary character, Jamie, and we tried to deliver more diversity in body shape. The next challenge was how to deliver something educational that is also engaging. There were several brainstorming sessions to arrive at a comprehensive list of key prevention messages that were important to get across. Those were then mapped across key drama points, figuring out how the education module would unfold simultaneously. The first cartoon lesson was taken back to students, this time our target group of year 8s, and as you can see, the first lesson was well received, but there was room for improvement. Student feedback enabled appropriate changes to be made. One of the most important notes received was that the students felt that it was not realistic for the cartoon characters themselves to be delivering the information. So instead, the characters were changed to speak more generically, and fact-check bubbles were added at the bottom of the slides to provide and support precise facts. By the final review, 100% of the young people rated it as good or very good. The final Our Futures vaping program consists of 4 40-minute lessons, ideally delivered 1 week apart during the year 7 or 8 health classes. Each lesson consists of a web-based cartoon component individually completed by the students. This will take approximately 20 minutes, followed by an optional teacher-facilitated activity. The program adopts a harm minimization and comprehensive social influence approach. This includes providing evidence-based information about e-cigarettes and tobacco smoking, normative education to correct misconceptions of use, and resilience skill training. This is a short preview of one of the scenes from the module. We currently don't have audio, but we are in works developing those. To determine the efficacy of this program, a 2-arm cluster RCT among the Year 7 and 8 students is currently taking place in New South Wales, Queensland and Western Australia with just over 5,000 students. We've managed to recruit 40 schools with 20 in an active control group completing regular health education and 20 in the intervention completing the vaping program. This is state-by-state design. The primary outcomes is to determine whether or not the Our Futures Vaping program is more effective than health education as usual in preventing the e-cigarette use at the 12-month mark. Here's an overview of our study timeline. All students in control and intervention groups will be invited to complete online self-reporting surveys on 6 occasions over 3 years in supervised classroom settings. Our sample had a mean age of 13.3 years, slightly skewed to male. About 90% of the participants live in major cities, and a little over a third are from culturally and linguistically diverse backgrounds. To wrap up, key strengths of the research include simultaneous targeting of both e-cigarettes and tobacco cigarettes. We have a large sample spanning 3 states. However, because of this, we are relying on self-reporting measures, which may be subject to reporting bias. The program is a highly feasible and rapidly scalable approach using an existing online platform. We did have some delays accessing public schools, so the information is unlikely to be a representative sample. Thank you so much for your time.